Hello all, very good afternoon. We were discussing regarding the coronary artery diseases. In my previous class, I have discussed regarding the coronary atherosclerosis and acute coronary syndrome, and now we'll discuss regarding the angina pectoris. So this angina pectoris, it is a clinical syndrome. So mainly it is characterized by pain or pressure of anterior lobe. So this is mainly occurring due to the insufficient blood supply. So you can see in the picture here, this is a heart disease. The plaque is being built here. In the angina, when the blood is flowing, it is becoming very harder for the blood to flow from one end to the another end. So during which we are having the pain, this pain is termed as angina pectoris. And if it is completely blocking, it will result in the heart attack. So here the plaque will crack and a blood clot will release and it will block the artery. But in angina, it is harder for the blood mainly to go through the pathway that is available. So during which, because of the pressure variations, it is causing the chest pain. When we can call it as an angina means it is nothing but when there is chest pain and there is discomfort and there is chest tightness that is occurring when an area of the heart muscle, if it is not receiving proper amount of blood supply or proper amount of oxygen, then particular thing it is called as angina. So here these are the possible areas of chest pain. So here you can see the blocked artery and it is very harder for the blood to pass to the other end. So this one is called as angina. Coming to the types of angina, we have stable angina, we have unstable angina, we have variant angina, we have microvascular angina, and we have silent ischemia. So in stable angina, it is predictable and you can have consistent pain. And if you take rest, the pain is being relieved here. But in unstable angina, it is also called as pre-infraction angina. So symptoms occur very frequently and it will last longer than the stable angina. In stable angina, for suppose if it will last for some period and if the person is taking rest, the pain will go off. But in unstable angina, the symptoms, they are occurring more frequently and they will stay more longer. And pain, it can also occur during the rest, whereas in stable angina the pain is disappearing when the person is at a rest, but in unstable angina the pain, it will also occur during the rest. And coming to the variant angina, so this one is also called as Prinzmental's angina. Here the pain at rest with reversible ST segment elevation, it is thought to be coronary artery blockage. Coming to the microvascular angina, so it is otherwise called as angina X syndrome. So you can have the patient will have, so in this the patient is having chest pain, but in coronary artery block you cannot see any kind of blockage, but the pain is mainly due to the blockage in the tiny vessels. So the tiny vessels which are supplying the heart or which are supplying the arm or neck, if they are not working properly, you will get this microvascular angina. And we have silent ischemia. So here with proper evidence only we can say the patient is having silent ischemia. So whenever we are doing the electrocardiograph, so you will see the changes with the stress test. So the patient is not reporting any kind of symptoms. But whenever we go for proper investigations, whenever they are doing the test or investigation, during those times they can found this silent ischemia. These are some of the types that are present in the angina pectoris. Coming to the pain features of the angina, so it is usually starting behind the breastbone. So what you will observe squeezing, you will observe burning, and you will observe tightening, and you will observe aching across the chest. So it is spreading to the neck, jaw, arms, shoulders, throat, back, or even to the teeth also you can observe in the angina. And here attack of stable angina, it is lasting for 1 to 5 minutes. So as we have seen here, the stable angina, it will last for 1 to 5 minutes, but unstable angina, it can last more than 5 minutes and it occur more frequently. We'll see what are all some of the typical features across that you can observe in the acute chest discomfort. If it is angina, the duration is about 2 to 5 minutes or less than 10 minutes, and in quality you can observe pressurness, you can observe tightness, you can observe heaviness, and you can observe burning sensation in the heart. So the location is always retrosternal, so it is radiating to the neck as you are seeing in the picture, or it is radiating to the fingers, it is radiating to the shoulders, arms, or more frequently it is on the left side only. So what are all the associated features here? So here the angina is, you can see more often when the person is exhausted and the person is exposed to extreme cold, or in case of any psychological test, if the person is having S4 gallop or mitral regurgitation, you can observe the murmur also during this pain. In unstable angina, this lasts for more than 10 to 20 minutes. It is similar to the angina, but it is very severe, and location same like angina only, and associated features are same like angina, but it can also occur with low levels of exhaustion, or even at rest also it can occur. When a person is exposed to extreme work, or when a person is even at rest also, you can observe the unstable angina. But in acute MI, in acute myocardial infarction, it will stay more than 30 minutes. It is staying more than 30 minutes. Similar in quality to angina, but it is more severe when compared to the angina or unstable angina. And this location is also same. It is the retrosternal area, and it can be radiated. So it can be radiated to the jaw or neck or shoulders or arms. And coming to the associated features, so the pain is unrelieved with nitroglycerin also, and the pain it is associated with heart failure as well as arrhythmia. So these are some of the typical clinical features of or major causes of acute cardiac discomfort or acute cardiac chest pain. So these are some of the typical features of major causes of the acute cardiac discomfort or acute chest. Coming to the management of the angina, so you all know why the angina is occurring, because there is decreased blood supply to a particular part. So here the name itself is saying transmyocardial laser revascularization. So what is revascularization? If a part of heart or if a part of the blood vessel is not getting the blood supply, if the blood is re-entering into the particular part, we are calling it as revascularization. So here using the laser, what they are doing, they are creating tiny channels. So they are creating tiny channels where the area, where the coronary artery or where the area of heart muscle is not getting proper amount of oxygen supply. So what they are doing, they are creating the channels. So they are mainly creating the channels into the left ventricle of the heart. So here the left ventricle of the heart, it is the main area, it is the main chamber where the rich oxygen supply blood is entering, and it is supplied all over the body. So here when they are making holes, when they are making channels into the left ventricle, the same blood which is oxygenized and is being supplied to the other parts of the body, it can enter into the new capillaries that is being formed, new channels that has been formed using this laser, So the oxygen rich blood, it is entering into the new channels that were formed, and it is supplying blood to the oxygen deprived muscle. So there again the revascularization is occurred. So they don't know how this transmyocardial laser is exactly working, but they believe that this is helping in the angiogenesis, means this is helping in the new vascularization, new formation of blood vessels, nothing but angiogenesis. So this is how the TMLR is being done. Hope you understood. What they will do means they will use the laser channel. They will use the laser mainly to create channels, mainly in the blocked artery or blocked blood vessel. So after creating the channel is mainly created into the left ventricle of the heart. So this left ventricle heart is very rich in the oxygen supply. So this oxygen is so this oxygenated blood, it is entering into the newly created channels using the laser. So once the blood is entering, so you can see here it is being filled with the oxygen rich supply. So here it is again causing the reactivation of the muscle, because the blood is entering into the muscle and it is causing revascularization. There are more chances. They believe that it will do revascularization, nothing but development of new blood vessels, which is called as angiogenesis. So with this, I would like to end this session here. Hope you understood regarding the angina. If you have any queries, please drop them in the comment box. I'll try to clarify. This is very simple. So we have seen what are the types, what are the features, and what is the management that can be done. And if you have queries, please let me know. Thank you so much for watching. Please like, share and subscribe the channel.